Okay.
All right.
Thank you so much for having me today. And yeah, that was a lengthy bio, but as you can tell, I get a little bit bored and have to try on new things. So, thank you so much for having me here. I just want to acknowledge that we're talking about a sensitive topic today. We're going to talk about stillbirth. As I go through this information. So I just want you to prioritize your well-being. I recognize most of you are from a professional lens, but we do like to make sure that you engage in the topic when you're ready. And then I'll also just say thank you to the South Carolina Department of Public Health as well. I know Elizabeth is here to support us. We've had a fantastic engagement response in South Carolina, and so grateful for that. And this may not follow the same track as other echo sessions. That's just because when we look at our patients and baby save stories, we feel like it's important to take advantage of the overall information and make sure everybody's on the same page. So just a little bit different today, but I appreciate the opportunity to be here. So if you're not familiar with Count the Kicks, this is a highly effective and evidence-based stillbirth prevention program. This is known as an early warning system. It got its legs in Iowa. We are founded by five stillbirth families. And in their words, what they wanted to do is create a campaign or create a way where somebody else didn't have to join their club. Other families didn't have to experience what they did. And we have saved lives across the United States and globally as well. So when we talk about this education, this is the foundation that we're at. So just really quickly to level set, when we define stillbirth, we are working with the CDC and the WHO definition where we talk about the loss of a pregnancy at or after 20 weeks. Globally, around 2 million stillbirths occur, but nationally, when we look at the United States, more than 20,000 stillbirths are occurring, and there are different disparities across demographics that are represented. And so, why does this matter? The number of stillbirths far exceed the top five leading causes of death among children aged 0 to 14 combined. So, when you look at all of these causes of death, stillbirth is at the very top of that. We also know from research that at least 25% of stillbirths are preventable. Now, not all stillbirth is preventable. I don't want you to take away that Sarah said that. That is not true. But what we know about the Count the Kicks campaign is it can serve as an early warning system and prevent some of those stillbirths. So, looking at that, we also take into account that that early warning system not only impacts baby, but it's also having an impact on mom, and therefore it's having an impact on the family unit. So we want to acknowledge that there is some progress being made among the stillbirth, like when we take a look at those metrics of stillbirth, but there is still a lot to be done. Also, there is somewhat of a misconception that it's only high risk pregnancies that can end in stillbirth, and quite the opposite is true. What we hear from what we call baby save stories, and when we talk with our families who have lost babies, we know that this is not just high risk pregnancies. We know that also when you take a look at income settings, stillbirth rate is higher in rural areas than urban areas, still occurring in urban areas. We know that as we widen the gap between the opportunity to access prenatal care, that we're seeing some of this have an impact. If someone has to drive 2 hours to have a baby delivered, there is a lot that can happen in that 2 hours if someone was already experiencing some trouble. So, just to give kind of some context there, and of course, maternal age. Also, we see a higher incidence of stillbirth across mothers that are aged 40 to 44 years old. Let me realign that slide just a little bit there. And here is just an overview. Actually, this number has just come out recently. In July, we were notified of a trend change. So it is now 1 in 185 pregnancies end in stillbirth. This is an improvement. It was at 1 in 177. So, like I said, there is work that is being done. But I also want to point out here about this slide, these numbers are not inevitable. When we work together, when we are taking a moment to step back and look at the larger picture of pregnancy and of education, We think about those communities that we serve and who is involved, the rich birth practices and traditions. As we work together, we can have an impact on these numbers, but they are very real. And so just wanting to again acknowledge that information. So, if you are in the legislative world at all, maybe you heard about something called the Maternal Child Health Stillbirth Prevention Act of 2024. We champion this work with bipartisan support, and this is the first piece of federal legislation that specifically addresses stillbirth. There is still more work to do, but this gave the opportunity for health departments to utilize those Title V funds to include research and activities to prevent stillbirth. So that is something very important to recognize. And then here is the picture of what is happening in South Carolina. Again, we're leaning into a trend analysis from CDC Wonder data, but approximately 315 babies a year are impacted and lost by stillbirth. So it across South Carolina. We believe that our campaign has the opportunity to save an average of 101 babies per year, just again through this education. And I'll share with you, I talked about baby saves. We actually have a baby save to share with you today. This is Lila. And when you get a copy of the slides, all of these links are embedded for you. You can take a look at her story, but would just like to point out that this is a story that came from your state. This mom, Jessica, was using our app to do her counts every single day. And then suddenly she had a change in her movements. She noticed this because she was paying attention every day, and that is the key. She was paying attention to those movements. She knew what was normal for her. So when something was off, she contacted her provider, and it was determined that Lila needed to be delivered. So that is kind of our, one of those anecdotal pieces of evidence. Let's talk about the research that exists about fetal movement monitoring. We are based on something called the Norway study. Dr. Ruth Fretz is a researcher from Boston who participated in this, and this was conducted in the early 2000s. What happened in this study is that a cohort was set up across the entire country of Norway with these pregnant, expectant families. They were taught to look at the fetal movement data every day to record those. They were told to pay attention to patterns, really to make sure that they were doing it at the same time every day. And if they noticed a change, then they were supposed to contact a provider. And ultimately, these people were seen by providers when fetal movement change was notified and intervention was done if necessary. So they saw a 30% reduction in the stillbirth rate across the cohort of this study. And the important takeaway here is that these parents were educated on getting to know what was normal and to speak up and to get that care as needed. So I mentioned Iowa. We got our legs in Iowa. I'm actually based out of Iowa as well. And this is what our data looks like for the life of our campaign. So that red line at the top is the national stillbirth rate. The teal dots and that trend line is the Iowa rate. And this goes all the way back to 2003 when those five babies were born to our founders, and they started immediately investigating what could be done, where could a difference be made for other people within their state. So as you can see, the trend line goes up and down. When we think about what happens with the pandemic, what can happen with currently we're seeing a lot of impact from syphilis and from measles. So any kind of impact there. We've also seen an impact from smoking. As smoking goes up and down, we see an impact with that across our state. So this trend line really reflects to you what has happened across the life of our campaign. I will also highlight for you that across Black mothers that we, when we look at this epi data, what we've seen is a 39% reduction that has continued across the state of Iowa with Black mothers for the stillbirth rate. So we know that there can be an education campaign that can be successful and in helping to drive those rates down. We've been published in BJOG and AJOG. Many of you are probably familiar with these publications. but they're important to the founding of the work that we do. I also want to point out that something else that is important is the standardization. So it's one thing to just get the materials and have them in the office, but we also want to make sure that we're addressing the standardization of the campaign. So making sure that every patient is receiving the information, not just some. We're making sure that everyone has access. Is it through the app or is it through another tool to record that fetal data every day? And that they know what to do, and that everybody within the facility is familiar with how to respond to questions, how to make sure that it's recorded in EHR. So there's really something more going beyond just getting these materials. So I will share with you that these materials are completely free thanks to our partnership with the public health department. And we have been able to, I've worked with Elizabeth the entire time I've been at Healthy Birthday. We've worked very hard to make sure that we have a variety of materials. We've looked at the top languages for utilization, and we've also added into the free things that you can order. And this is free from our Count the Kicks website. You can also order our wristbands, and I'll talk a little bit more about those towards the end of the presentation. But essentially, we want everybody to have a way to access counting their movements, whether it's through a digital application or a printed application or this just using it on their hand. And I know there's a word for it, and right now I'm struggling for that word. I haven't had my Dr. Pepper for the day yet, so I'm sorry for that. Kinesthetic opportunities. There it was. Okay, so a little more research to share with you, and as we talk about this material is that we know from other research papers, Dr. Hazel is one, is that pregnant women should be educated about the awareness of fetal activity and reporting these abnormal activities to health professionals. This is something that all the professional organizations share. If you're familiar with the Hear Her campaign, that's one of those 15 warning signs right smack in the middle is being aware of those movements. A1, we've recently done a pathway with them. An algorithm is really important into how people respond in the OB triage situations. When someone presents with a change in their movement pattern and they have this data to back it up, not telling people to lie down on and to put an ice pack on their belly or to drink caffeine or something like that. We're actually wanting to eliminate those inconsistencies and reduce those barriers to care so that we can have an impact on the disparities. So this new algorithm, which is available for people to take, that will actually go through all of the evidence and a meta-analysis of some other research papers to share this clear guidance for decision making. And we do want providers to be the ones to make that call. We just want to eliminate some of the inconsistencies that we hear across the United States, the responses that are happening in OB triage. And I know I've worked in OB triage. I know that there are differences that come along depending on who you're seeing in triage. But it's just really important for us to support the training and implementation of that. Sometimes we get asked about our app and anxiety. Like if we're telling people, if we're harping on this, are we going to increase their anxiety about the pregnancy? And what we can tell from research is that 77% of our app users report feeling less anxious, and they feel this bonding with their baby because they're paying attention to that movement. And so, probably preaching to the choir, but why does movement matter and what are we concerned about? Well, let me tell you, this is the only way baby communicates before birth. It's the only sign that a baby can give when it's in distress. And we need to pay attention to those early warnings. Just another baby story to share with you. This is again an incident where Megan, who is Mabel's mother, shared that the only red flag, she was having a completely normal pregnancy. The only red flag was as she was doing her counts, she noticed a change in movement. She went to her provider with her data and she was able to talk with her provider, counsel with her provider about the next steps that needed to be taken, which were to deliver Mabel. So we hear those stories. I just got another one yesterday out of Indiana. We hear these stories all the time. And so it's really important that we are paying attention to what providers or I'm sorry, to what our patients are telling us. So as we talk about what are we counting, like when do we start and how do we do this? And I'll and then pause for some questions after I share a little bit about this. So, ACOG recommends beginning at 28 weeks gestation. If someone is high risk or multiples, we're going to back them up just by 2 weeks. But we know that in this third trimester, this is a consistent pattern that you can feel and track. And as a reminder, we count everything but hiccups. Hiccups are involuntary movements, and so we are not going to utilize that data as we're tracking for movement. These are our 5 steps that we can share, and this is a digital download that you can get from the website if you want to embed this in your EHR. We're happy to give you access to that. This is the counsel that we give. We want somebody, as you've heard me say before, pick the method that works for you. Of course, I'm going to talk about our app, and I'd love for people to use our app. It's very easy. Most people have access to a phone. But for those who don't, we have different ways. So we're just going to help patients pick a way that works for them to monitor. We're going to counsel them to track every single day. And this is really exciting for the first couple of weeks, and then people kind of get distracted by it. We don't want people to stop because we want them to really be paying attention to that data. When they come into OB triage or they come into their provider's office and they are insisting that they've got a feeling about their data, 5 days data versus 6, 7 weeks of data is a little bit of a different conversation an analysis standpoint. So we don't want people to stop. We want them to pick the same time every day and stick with it. We do want them to pick a time when baby's normally active, and so that's another reason for thinking about that third trimester. Usually people have an idea of what baby's doing. So timing how long it takes to get to 10 movements. And I'll tell you, 10 and 2, that's what I learned in 1998 in nursing school. That is outdated. So according to the research studies, we need to be monitoring each baby and each mom for that particular pregnancy. So if I have 5 pregnancies, I should have used this system for each of those pregnancies. And that is something that I also would hear in OB triages. I learned how to do it with one. I know what I'm doing until they don't, until there's a concern. And then it becomes a, why wasn't I doing this? Why wasn't I paying attention to this? So please make sure that everyone is tracking every single pregnancy. And my time to 10 minutes might be different than yours. I just was at a baby shower in Virginia last month and I heard somebody tell me I'm 4 minutes a day, and she pulled out her tracker and could show me she was 4 minutes a day. For other people, they may be towards an hour, but they'll know what their norm is if they're counting every single day. So we want them to lean into that. After a few days, you're going to begin to see an average length of time it takes to reach that 10 movements. So just getting into it, recording that data, you're going to need to continue, but you will know what your average is. And if they're using the app, they will see a chart. They will see that longitudinal perspective that shows them every day, and that data gets stronger the longer we do it. Our 5th step is to call providers right away if you notice a change in the strength of the movement or how long it takes the baby to get to 10 movements. So, what is their normal and what is that variance? We want them to get in touch with their provider for that medical decision making. So, I think, Rachel, it's okay. I'm ahead just a minute or two, but is it okay if we see if there are any questions or comments?
Perfect. One moment.